Thank you, Vicki. And it's nice to see all of you here. I know this night has been a long time coming, and I'm happy that I can be here for it, and I'm glad that you are all here as well. First, let me offer my thanks to Sheila Gastro. My colleagues at Atlantic and I are grateful to you for your leadership at Inyatello in shaping, building, and implementing the UNEDSA program. And I would most especially like to thank Vicki Pinkney Atkinson, the pugilist of the long name, for your tremendous commitment to this program. And I know many of you in this room know that Vicki has poured her heart and soul into UNEDSA and applied her keen intelligence and sound judgment to the program. Where's Vicki? Thank you. Stand up, stand up, stand up. Before I share a few words about Atlantic's Health of Populations program, I'd also like to thank my colleagues at Atlantic who've contributed so much to the creation of the program. Christine Downton, our board member, who was, as many of you know, here for more than a year and a half, in part developing this program. Dr. Leinan Fong, who's the director of our population health program. Zola Madikizela, who's a colleague. Fiona Mangieri. Fiona Mangieri and Dr. Oluse Oyedele. Many of you know that Christine, as I said, is a member of Atlantic's board, whose commitment to South Africa is so strong that she came here to work full-time in 2006 and 2007, really as a member of our health program team. It was Christine's initial work on nursing in South Africa in partnership with Zola that laid the foundation for UNEDSA and for our celebration this evening. So thank you, Christine. I joined Atlantic only last July as vice president for a number of our programs and areas of activity, including Health of Populations program. And as I was contemplating joining Atlantic, the health work held a strong attraction for me, especially what I think of as our common sense approach to guaranteeing the right of quality health care to people who need it. Every day that I work with our health team, which Fong is now leading, strengthens my belief in Atlantic's approach. I have to say that my very first week at Atlantic was spent in South Africa. Atlantic's health commitments are many and varied, including supporting advocacy, public health campaigns, the creation of new hospitals and health clinics, and more. One commitment of ours to which I would like to draw your attention is our commitment to healthcare resources, especially human resources. This means major investments in the countries in which we are most active, South Africa and Vietnam, and to a lesser extent, Cuba, in educating, training, employing, and retaining health professionals who can best deliver care. We support community-based, proactive primary care carried out by healthcare workers as one of the best ways to maintain the health of specific populations and also to battle pandemic disease. In South Africa, we are especially interested in knowing that primary care nurses and physicians are able to deliver care in rural areas, and we're funding several programs that address that. Within that context, I hope you can now better understand our commitment to UNEDSA, which is designed to improve the health of South Africans by training more highly educated and skilled nurses who can, in turn, train many more nurses to deliver high-quality care. There is a lot more to say about UNEDSA, and for that, I ask my colleague, whom all of you know, Kosi Kaba, who is a program executive in our Joburg office and is herself a nurse. Kosi?